What is the relationship between traffic light system, car company, and a seriously ill child? Hi again, everyone. It's Dr. Khaled, one of the doctors in the UK. Today, I'm going to speak to you about the traffic light systems that we normally use in order to identify a seriously ill child. So, what's the relationship between traffic light system and a seriously ill child? In a nutshell, traffic light systems that you find down in the streets is a very safe system that you use in order to make sure that you're organizing the road works or the traffic system. So, for example, red sign meaning is it's dangerous to go ahead. You should stop now. And if it's amber, this is actually a sign to you that you should slow down and you should stop and you shouldn't go further. And green actually is you can actually go ahead without any problem unless if there is any passenger or if there's any harm to go ahead. So if it's safe to do so, you can go. So this is the traffic light system that you find in the streets. So what is the relationship between that and the seriously ill child? NICE or the National Institute of Care and Excellence has set a very nice schedule that will make your life easy whenever you see a child and then you're trying to make sure that they are not having a serious illness and they don't need any further medical interference now. So the NICE schedule, like I said, is actually being done in order to identify the seriously ill child. So it's being identified in colors. It's being set in colors: red, amber, and green. So you can imagine that red is a seriously ill child. This child actually should be dealt with, should be treated now, and that should be in the A&E or by the specialist. So this is a seriously ill child. However, when it comes to the amber color in the traffic light system, meaning is the patient or the child could be on a moderate risk of being a seriously ill child. However, when it comes to the green color, so the green color itself is, you might feel and you might say it's safe. So the patient could be at very low risk or they can be at no risk of being a seriously ill child. So this is the relationship between traffic light system, a seriously ill child. So what's the relationship between both of them and a car company? In order to understand the traffic light system that's being set by NICE, so it's very important also to divide that into mnemonics. I have invented a mnemonic and that should make your life easier when you go through it. I will only give you a rough idea about the NICE guidelines or that kind of schedule that will make your life easier. Like I said, in order to make your life easier, I set a mnemonic which is called CARCO. So when you hear CARCO, remember car company. So CARCO, C in a CARCO stands for color. So color actually when a child presents to you and you might feel that they have got like pallor or they have got like bluish discoloration. So at that time you think it's not a normal child, isn't it? So if that child's color is pinkish, you might think that you've got good circulation. So at that time that sets them in the category of green. However, if it's pale, for example, if the child is pale, so that might put them in the category of yellow or amber. However, if the child is has got mottled skin or bluish, or sometimes also if it's pale as well, at that time you should think that this child might be having a serious illness, and then they can be put in the red category or the red zone. Then when it comes to A actually is about the activity. If the child is actually active and moving and playful, so this is a good sign that this child is having no serious illness, at least at the moment. So this can be put on the green zone. However, if the child is less active or not responding as they used to do in the past, so you might think about whether are they in the amber zone or in the red zone. So this is a rough idea about A or activity. When it comes to R, So R actually is respiration. If the child is breathing properly, so this sets them in the green zone. If the child has got a problem like not able to breathe properly, or if they got grunting, or they use accessory muscle to respirate or to breathe properly, so this is actually puts them either in the yellow zone, the amber zone, or in the red zone. So in a very easy way, if a child has got intercostal recession or they use extra muscle of respiration, so this is not a healthy sign and they should be seen immediately. When it comes to C, so C actually is circulation. If the patient has got moist membranes, so this is a good sign that they are well hydrated and they have got no problem with their circulation, and this is a good sign, and this is should be put in category green or in the green zone. However, when you think that the patient has got a problem with their circulation and they have got, for example, their capillary refill time is really prolonged, I would say like in 3 seconds or even more than that. So this is not a healthy sign, and this means that they should be seen, or that further medical treatment should be started immediately, and then they can be put in the amber zone or in the red zone. Then when it comes to the last thing, the O actually is other things. So if the child hasn't got any other warning signs or anything that you should consider as a serious illness, they can be put in the green zone. However, if there is any other problem that you should, or you could think about that, no, this is not a healthy child, could be put in the amber zone or in the red zone. Like I said, I'm just giving you a rough idea about that system. It's a very useful and very beneficial system. You can use that in your daily life while you're dealing with a seriously ill child, or even with any child that you do think that they might develop serious illness in the next few hours or in the next 48 hours, for example. So very important thing that's been put by NICE. You can also give that, or can print it out and give that to the parents, so that they might have a good idea about when they should start worrying about their child, and then they can seek further urgent medical advice. I will just be putting the NICE guidelines about that in the comments. Please go through them, and please, if you do like my videos, support my channel by subscribing to my YouTube channel in order also to receive all of the new videos in time, and then not to be missing anything. Thank you very much, doctors, for watching my video today. I hope you enjoyed it, and please, if you've got any other concerns or have got any questions, just feel free to put them in the comments, and I hope that I can answer them on time. Thank you very much. Have a lovely day. Take care.